Well, Ed's getting warmed up. Amber Cam is relatively new. Eddie's a fella from many years ago and now a stalwart in LA, Cedar Sinai. Love to have him still involved.
Okay, good. Right there, got it. That look right to you guys?
Don't see
Yeah,
a screen yet.
Great, great. Yeah. So, yeah, I did 10 years ago, maybe 11 years ago now. I was graduated in 2012. So the last 10 years, actually joined a private practice group that was mainly associated with Cedar Sinai, but we are our own private practice group. So I do have privileges at other hospitals as well. And, when I was asked to do this talk, this is the second year I'm doing it, to have, 10 years of some insight, wisdoms, mistakes along the way. So trying to help you guys out for those that are in their younger years of practice developing this. And I think the one pro of this, that this is going to be, very much opinion based in my growth as a spine surgeon. And I think the other thing is that, you've got to just kind of see everybody's experience and what they brought to the table is going to be different. So it doesn't apply to everybody, but hopefully you can get a little bit out of it, even though if your practice is different. So, I joined the practice. There were two spine surgeons that were in the practice, and I was the third to join. So we have a spine only group. So I was the third guy to join. We have 6 people now. And this is in the setting of joining a conglomerate at Cedars, where I was the 15th spine surgeon to be on staff. And we have, somewhere around 25 to 30 now. That's the kind of situation that I joined. So that is very different from joining a solo private group or a group where you're the only orthopedic surgeon. Only spine surgeon amongst a group of orthopedic surgeons. When I look at just kind of how you evolve as a surgeon in your first few years of practice, I think key things you need to take into account are that, year one, you're just learning how to practice, how to become a doctor, setting up your clinics, trying to figure out how to set them up, get through them. Over time, you want to try to build efficiencies in that. And when you're in the operating room, depending on, if you're by yourself, you have a PA or you have a partner, which would be great. I mean, you're basically surviving in the OR, trying to get through the cases. I mean, try to do the cases right, but trying to get them done. And I don't necessarily that you're striving for perfection. You do, but it's very different the way you practice your first year or first few years than you do later. As you start, that's where you're starting to increase your volume. Your skills are improving. You're starting to do more surgery, and I think the focus of those years though have to be your boards. The boards, I don't think that they're tough, but they're onerous. It takes a lot of time to prepare your cases, get everything together, and then making sure that you're doing the right thing, that when it does comes to the time for boards, that you're able to do a good job and pass them the first time. Okay, because it gets tough if you don't pass the first time. It just gets, not that it's harder. I mean, you know what to expect, but it's just the process you have to do all over again. And I've had a partner that's had to do it, and wasn't fun for him. And then years, I think 4 and 5, in refining surgical skills, increasing confidence. But with that, I think you start to get more complications and issues develop, because the more you do, the more issues you get. And you guys don't see my slides, but I have the big emo money mo problems here, because it's just the more you do, you start opening yourself up to having more complications and issues. And
Hey,
yeah,
Eddie,
yeah.
real quick, Jamie Bruffy. Hey, can you? I don't want the specifics of your partner who didn't pass, but was there anything for the fellows that they should know about of the why of that? Not maybe specifically, but just was it a generality thing or something they can avoid? Do you know
Yeah,
what
yeah.
happened?
I mean, I went through the cases with him, and I mean, I think the ones that specifically that I thought was going to be a problem, and I do the surgery myself. I don't know if it was a lumbar disc replacement. Just I think it's indication to that, and if you run into the wrong people, and also they're just, I mean, I forget exactly the specifics now and the questions that he had, but I think some of it is definitely indications and how you chose that patient. I think is, and you got to do that for all 12 of them, right? If you miss one or two and somebody harps on it, then I think that could be an issue. um And then I think that the
Yeah.
next part
Thank
is
you.
the
Thank you.
yeah, no problem. The next part, as you're starting to develop yourself, is just incorporating technology and newer techniques. You start practicing a lot how you started or you completed your fellowship. I think that's what is the main influence. And with time you'll learn about other types of techniques, et cetera, and how to adopt those. But again, I think these are things that come later in that first part of your career. So I think the first few years when I think the key thing is that you want to focus on becoming the best spine surgeon you can be, meaning skills wise in the operating room. There's many distractions, including, like the ones I say, the fixed distractions, right? Financial, overhead, issues with in that, or relationship with your partners and family, right? And then there's also extraneous such as friends, industry, research. Those types of things will come up as well, and just kind of figure out how to really practice being the best surgeon you can, whether that's the ability to scrub in with your senior colleagues, go to courses, etc. But I think that should be the main goal early on. They always have those, certain rules, 10,000, 500 cases, whatever that is. But it's really trying to get there, I think, is the important thing as that will help develop the foundation for you to move forward with other aspects of your career. I think balance early on is pretty easy because you won't be as busy. So, with work and life, that wasn't such a big issue at the beginning, but over time that will definitely be something you'll need to work and see, what helps you become the better person and surgeon you can be. For me, it's going to the gym. I like to do that regularly during the week, kind of let you stress out. I know, my colleagues that are on here, what they do also. You try to find what is that doesn't take too much time, but also allows you to be, focused, both physically and in the mind. And I think the important thing just to talk about one more time is that you need to be very wary of where your cases are from day one, because everybody says your boards collection starts at some 6 month point, can be a year into your practice, but there is a high chance that revision surgeries will develop, and you're going to have to explain those revision surgeries, why they're being revised. If you take on a revision surgery, even in boards collection, they kind of know why are you doing this? What do you think happened the first time around? So you're not completely exonerated of somebody else's surgery. And you got to remember that this is going to be until you pass. So even after those 6 months are done, you're still going to do cases, and those cases may actually come up themselves in the future if you don't pass, right? So you just got to be very conscious of what you're doing, and also the whole, I see people where their cases get passed on by their senior colleagues onto them. Sometimes during boards collection, and it's you're gonna have to say no, and or do it co-surgeon, or however you want to do it. But it's something that you probably don't want to take on if you think it's questionable. If you're thinking there's a question, it's not worth doing that case. And then, just in general with practice principles, where everybody, we hear of 3 A's, 5 A's, and, when you have the 5 A's, the affability, likableness, I think it's being humble, both in in the clinic, operating room, amongst your colleagues, staffs and nurses goes a very long way. That will be very helpful. I mean, for me, I thought it was very helpful just kind of just doing my thing and just kept my head down at Cedars for a few years, because there's a lot of personalities and just learning to navigate and deal with them. Availability, being able to be there for, to help out your partners, whether it's an operating room, seeing consults, allows you to meet people, and get around, to just meet the various people across a big institution. And I think with that, opening communications with physicians and teams, I do a lot of emailing or messaging through our Epic system, to physicians, that I know and who I don't know, just to introduce myself, as we're taking care of people. And I think people like to do that because communication, I think, in medicine is significantly decreased. And I think, people's notes, what they're writing, is just all copy and pasted these days, that you don't get really real information. So being able to communicate, I think, is great. One of the A's, ability, plan your cases, and when you're planning cases, especially your first years out, remember you're attending, right? You're not Mundus or Eastlack getting in here and doing cases, day one. You're, yourself, and you need to plan these, and things are not going to go as fast or as smooth as you've seen them. You kind of have to plan for, what a plan A, plan B, plan C, maybe, adaptability, understanding your environment, who you're working with, I think is going to be very important. And, to be assertive, things that, you're well trained. So it's kind of talk about being humble, but also you need to be assertive and, establish yourself in your practice. Finding mentors, I think, is very important to seek, help and advice, and trying to identify those people early on will be great. And some of it will develop organically with time too. And I think the one thing that has helped me a lot is just the appreciation aspect of just being appreciative to your nurses, anesthesia staff, cleaning team. That goes a long way. If you have the people behind you, your turnover times, your life practice, people will do a lot for you because they believe in you, and if you're treating people well. So that's something that I think is very important to establish early on. And when, as a surgeon, as you're starting to make choices with patients, I think in regards to decision making, better to be less invasive, and trying to treat goals of surgery. I think it's better to do less than to do more. And trying to explain the benefits, risks, alternatives as best as you can. Sometimes doing less won't succeed. You do a decompression, the option for decompression or decompression and infusion. You chose a decompression, it didn't work out. I'm sure you've told the patients, I've told them many a times, hey, this may not work, but to them, sometimes it's a selective memory and they don't remember, or they may get, I don't know if it's upset or disappointed, and they may go see somebody else. And those are things that I think you just need to know that is going to happen. Okay. With second opinions, they oftentimes will go see the most experienced surgeon, especially early on, and you get a little frustrated because you chose a lot of time with them, but that's going to happen. That's okay. Okay. So just remember that is okay, and it happens to everybody. I think patients in the operating room, again, you're not going to do these cases as fast as you've seen them being done. It's going to take some time, and that's okay. You're going to be slower than the surgeon next door to you, and early on, and that's okay. You just want to do a good job. Okay. Prepare for your cases. Okay. You may have seen them done many times. You may have done them many times, but prepare. Take a look at your imaging beforehand. Figure out what steps you need in order to succeed. And in the end, trust yourself, your plan, your training when you're doing this. there's going to be tough times. Okay. But you've been there before. You've seen it. Okay. You've got great fundamentals and foundations from your fellowship. So you'll be able to carry those forward. Just little pearls on clinic, I would say dress sharp. Not that I do that all the time. I don't like changing. So when I have an OR day, I do go in scrubs, but I have some nice big scrubs that are fitted though. So they're nice. But in clinic, I always say just dress sharp. I think patients appreciate that, especially when you look younger. I remember I was trying to look older. Now that I'm getting older, I try to look younger, but I think dressing well will always be good. Taking time with your patients, take time to communicate, explain whether you have models, any kind of media. I think that is all helpful for patients to get, and they like it. And I think always discuss non-operative and less invasive options. Also, I've had a lot of patients that have come to me, and I know patients that have gone to other surgeons because they said, hey, the other guy never told me that there was this a less invasive option. I think just by you describing that or showing that you are thinking in other things, not just saying, hey, just we're going to do a 4 or 5 fusion on you, that patients appreciate that. And in terms of your practice management, I think in the end, when you first start, you start sharing people. I think when people get added on, most of the time they get a shared practice person in their practice. I think having your own surgery scheduler is very key. Somebody that's going to bat for you, that's going to put your cases on first instead of her more senior boss. I think that's very important. Having very good people that are on the phones. Phones are very important. That's the way to enter into your office. And I think how you market yourself, I think, is going to be important. I've given talks to the community. I think the 2 pearls I would say, I know time is getting short, guys, is that you want to try to target younger physicians and providers. Each hospital system, they have a list of who the new people are. So you should see if you can access that list and just send a hello to, the internal medicine doctors, hospitalists, people we work with a lot, just to, introduce yourself and say hello. The way what I used to talk to physicians also was somebody that I shared in common that had a good result. I would just shoot them a message later and just say, hey, I'm so and so, Eddie Nomoto, and took care of Mrs. Smith, and she's doing great. Any questions or anything, please feel free to reach out. I thought that was helpful because it had you had some rapport with the physician. So I thought that was a better way, instead of just showing up at an office and just introducing yourself, just kind of cold calling. So that's the way I did it. May not be for everybody. And then lastly, just with industry talk, right? Relationships just develop with time. The way I chose to do things, I associated with people that I was comfortable with, people that I knew. I think always you want to believe in whatever product you're going to study, put in, whatever, and the company itself, and just your whole 5 A's apply within industry as well. If you really want to work with them, then you have to be available and dedicate time to it. Be pleasant in the operating room, right? It all starts with reps knowing you. If you're not pleasant there, then they're not going to they're not going to necessarily want to work with you. And people that you associate with, reps now, et cetera, these people move on in companies, and these are the people that end up making decisions later potentially. So it's always just, I try to be nice to everybody anyways, but just that's something to keep in mind there. And I think the last thing's, just do the right thing for the patient. I think whenever there's questions, seek advice from your mentors and trusted colleagues. And I think one of the big things for me and people that go into big markets are going to be just be patient with your growth. It's going to take time. I mean, to feel comfortable, people say 2 years when I go around. And, for me, it was 5. And I think that's just the place that I'm at, I think. But I think my colleagues now that are a little younger than me say the same. Thanks, guys. That's all I have.
That was awesome.
Thank you, Eddie. Yeah.
Cam,
Sorry about
Amber, you
that.
guys got any thoughts? Probably a lot.
Any any pearls for like strategies you use for kind of your board collection, just as far as like organization and everything like that?
Yeah. They can give you my more than happy to give you my email and info. We can do this. So what I did, which I think I don't know if you can apply. So I was there when they first started to transition, but I made the old binders. So I don't even know if maybe Greg has them still. I made everything like the old binder. So I had, so it takes double the work because I printed it everything, right? But I had that, so I always had that to carry with me so that I could look it over. Like I'm not a computer person that likes to flip through and look at screens. So it just depends, the generational gap between us on how you like to look in things and prepare. But I had it all on paper and made the old school binders so that I had it for each patient that I could go through it all. And that was the way I organized it. I had I think the minimum is 35 cases. I think it's still that. I squeezed right in at 35. You actually don't. It's a lot tougher when you have a lot more.
Great, thank you.
Yeah, they've transitioned into the electronic system now where unfortunately or fortunately, I guess depends on your personality. Everything's on the computer now, but once you load it in there, you can kind of review it quite a bit the same way you would be able to on like a paper binder.
Okay.
Hey, Eddie, I have a
Yep.
question for you. As you've gone from the transition to looking older to looking younger, do you have any like tips, tricks to look younger? Because I'm struggling. Yes,
Go down
like
in
some
Beverly
hair
Hills.
coloring tips, some hair
Yeah,
coloring tips.
he hasn't reached there yet.
Oh, there you go, Bruce. I knew that was coming from somebody. All right. There we go. Yeah, that girl party's like, what you talking about, Breathy? What you talking about?
Nice.
Hey, Eddie, that was awesome, man. A lot of awesome pearls in there. I would say this, I would just echo your comment of, when you come out and practice, you're kind of used to going 90 miles an hour with, your fellowship, and that's just not the case when you start. So I found myself getting frustrated quite a bit with just how slow things were. Sometimes in clinic, you're only seeing 5 to 10 people, maybe only doing 1 or 2 cases a week. But that's just the way it is. And so I would just, embrace that, do a good job with your patients, and eventually the volume will come. But that's an important point that I oftentimes got frustrated with.
Anything you guys did during that time that you think or wish you would have done during that time? I don't know, to maybe either enhance your practice or your just, or would you just go and spend the time with your family and enjoy it?
I think it's a
Yeah.
combination of things. Certainly, you can take call, like taking call helps if you're in a trauma center. That can kind of supplement your practice. But also, I think what Eddie said is awesome. Just communicate with the primary care docs, become friends with them, and then also spend time with your family. Just take that time because that's going to go away with time. But you will get busy with time. But just be aware that it's just temporary.
Go
Yeah.
and assist your partners, guys. If you have somebody you're working with, if you don't have cases, go help them because you can watch them operate. You can help them operate. You get your skill sets continue to grow. I used to do that. I used to go and do cases with the neurosurgeons, just would say, hey, you need some help, so that would be my advice as well. And spend time with your family.
Yeah, I agree with all this. Yep.
I'll add one other thing too that you'll wish you had done as you get busy, and that's just set up your practice. I mean, spend the time to do the little odds and ends that make your practice efficient, whether it's templates or organizational stuff in your practice. It gets harder and harder to spend time to do that later on. So, take advantage of when you have lighter days up front. It just makes your life more streamlined and efficient when you do get busier.
I totally agree. That's the very important point.
Yeah, like, and what they're talking about, taking outcomes. Yeah, implementing outcome measures, how you're going to do that in your practice. Like that, when you, the less people you have, the way easier it is to have that system set up for you. I think that's one of one of the important things that you know. Cool. What do you guys got now?
Did.
Yeah, thank you.
Thanks, Eddie.
Thanks, Eddie.
Appreciate it.
man.
Thanks, Eddie.
Thanks, Eddie.
Hope to see you soon.
Thank you, Eddie.
Thank-